Welcome to the Vet Med Wellness and Leadership Podcast, where we discuss central challenges vet med leaders face, such as burnout, stress, and difficult interactions with clients and staff, just to name a few. In each episode, you will hear about actionable solutions that you can apply to your practice and invitations to connect with fellow leaders who are passionate about improving the wellness of the vet med profession. By subscribing, liking, commenting, or sharing this podcast, you are helping more veterinary professionals find the resources shared in these episodes. Thank you in advance for listening and supporting this show. I hope you enjoy it. Hey everybody, Crystal Stokes here today, and joining us is Dr. Rachel Venable, who is a board certified as a medical oncologist from the American College of Veterinary Internal Medicine. Dr. Venable has always been surrounded by animals growing up on a farm in the Midwest. She obtained her veterinary degree from the University of Missouri and graduated cum laude. After veterinary school, Dr. Venable pursued further training as a small animal intern at the University of Georgia. She then completed her 3-year medical oncology residency at the world-renowned Colorado State Flint Animal Cancer Center. During her residency, she achieved a master's degree and studied new cancer therapies and clinical trials. Dr. Venable has authored numerous publications and has been a speaker on local and national levels. She is the founder of Pet Cancer Care Consulting, an innovative teleconsulting service which consults with the family vet and pet owner together to give personalized responses and needed information to make an informed decision on treatments. Her oncology philosophy is one of a team-based approach with the family and referring veterinarians for compassionate, individualized care and optimal quality of life for cancer patients and their families. So Dr. Venable, thanks so much for being here today.
Oh, thank you. I'm so happy to be here.
Well, how about we start off with a little icebreaker?
Sounds good.
All right. How about tell us a fun fact that not many people know about you.
So a fun fact is I decided as an adult, I was probably 38 and I decided to learn how to play the piano. So I just kind of threw it in the mix. I didn't have time in my schedule. It's like most things. There's never a good time. But I just always said I wanted to learn how to play the piano. So I've been doing it for the last couple of years and really enjoy it. I mean, I'm still beginner, but I have fun playing around on it.
So what's the secret to doing it as an adult and doing it with a busy schedule?
Well, one, you're paying for it. So whenever I'm paying for it, that helps me show up, right? Like, so it was just putting it in your schedule. For me, the evenings is really, so either evenings or sometimes I'll do it over lunch. That's kind of when I find time to do it. And then working with a teacher, a piano teacher. I think if I quit taking the lessons, I'd probably lose a lot of it because I wouldn't keep practicing at home. So yeah, I think paying for it and having a teacher. So then I kind of feel like, it's like you don't want to disappoint your teacher, right? So I practice and then I really do enjoy it though.
I love it. I'm the same way with tennis. If I didn't have a coach, I would never develop. I think it's the pressure to perform and have that regularity of the coach watching that really does help. That's really a cool, fun fact. Thanks for sharing that. And thanks for being on with us today. So oftentimes our guests will start off with a bit of their own full circle story that highlights the very, very common journey we experience in vet med of entering into the profession full of passion and drive and vigor for medicine and animals. And somewhere along the way, we kind of slide down to the bottom of that circle where we lose a lot of that drive. We might feel kind of apathetic and burned out. And hopefully with time, we find our way back to that place of passion. And I'd love to hear a bit about your own full circle story journey.
Oh, thank you so much. Yeah, so like in my bio, I grew up on a farm, so I've always been around animals. Didn't necessarily think I wanted to be a large animal vet, but just loved everything about veterinary medicine. So went to vet school. I had no idea about specializing. So it was really in school where I learned about oncology, and I really fell in love with just the science and all the medicine behind it and how we can learn so much from dogs and people really together. That's what really drove me, I think, into oncology. And I like the clients too. I like that as far as a specialty that you have clients. So, did that all the years of schooling, my mom wondering if I was ever going to get a job. So finally finished everything, worked in practice for several years, and I really enjoyed it. I actually also taught at a vet school. It was kind of this neat hybrid where I was still in private practice, but working at a vet school part-time, and I love teaching getting to work with the vet students. And really with COVID, and I think a lot of people, everyone has kind of stories there. And for me, my schedule was getting so backed up, and I just felt like there had to be a better way. There was so many barriers to care, right? Like just people not being able to get into me just because literally the wait time was too long. Maybe it was their own travel time, their own health, my growing up on a farm for even my own parents, they're starting to get older, and for them to get specialty healthcare, it's an ordeal. It's at least a 2-hour drive one way. And so just thinking about that increased access to care, I really started becoming more passionate about it when I really noticed it becoming an issue. And then also with things like Zoom and just, learning about all these video platforms that I think, 5-10 years ago, most people didn't know about or they wouldn't be comfortable with, it wouldn't really be acceptable in a sense. And so that's kind of how I ended up on the teleconsult front. I, was kind of ready for a change, and it just seemed like everything that was happening to me at private practice, it was sort of like God kicking me out of the nest, and sort of found my way into teleconsulting and trying to figure it out. Everyone's trying to figure out, how to use telehealth and what does it look like. The legal parts of it are quite interesting because I talk to pet owners. So there's a lot of vet to vet conversations out there. There's not really much regulation on that front. But when you pull in the pet owner, that changes the dynamic a lot. And the reason I pull in the pet owner, especially oncology, I find that's really where most of the questions are. A lot of vets, they may or may not treat cancer, but the person really needs that long conversation is more the pet owner. And I think it's hard for, as a specialist, to tell the GP all this stuff and then expect them to just regurgitate it, right? It's not that simple, especially with oncology. A lot of it is understanding how to give bad news. And I think that's something that maybe is getting better. But I know when I went through vet school, we were never trained how to do that.
Oh, I love how you lead into it. So that's really the meat and potatoes of what we're talking about today, is how to have difficult conversations the right way. I wanted to just briefly touch on a little bit of your story too, given you have an impressive bio and the depth and breadth of work that you've done. I think there's something we touched on in a previous conversation you and I had, was that change of priorities around, I'd say workaholism in quotes, so then shifting to having more quality of life. Can you speak to that just a bit and how you made that decision to go more the teleconsulting route and what that transition was like for you?
Yeah, so during all that time where I could tell I needed to figure out something else, part of it was just my work schedule wasn't working. I mean, it was something where counting commute time, I'd leave the house around 7:30. I get home at 6:30, and I've got 2 little kids, and my husband was doing everything. And, it was just, we could have gotten a nanny, but the biggest problem for me was just, I just wasn't there, and so it's just a time in their lives and my life where I wanted to be around more. And I think that's a hard thing and something veterinary medicine is trying to juggle, because it is, I'd say more often than not, right, the mom who is wants to be around more when they're little, especially. And that's not always the case, but at least for me it was. And so doing the telehealth now, I have a much more flexible schedule. And I think also just being your own boss, that's something too we don't learn a ton about in vet school, at least not in my experience. So, but when you have more control over your schedule when you're the one kind of in control of everything, right? So that's really helped me have a more flexible schedule. Certainly working from home, it's easier. And with all this stuff, really trying to figure out how to prioritize my time. Because I still find myself even now where I can be sitting at my computer for hours, right? And if I'm not careful, because there's always going to be more work. And so that's something I've learned from people and other people even working from home, is it's like at some point you just have to decide when to stop. Because it's like, yes, I can, plug back in when the kids go to bed. But again, at some point you just have to stop. So it's trying to prioritize what emails really need responding, what really needs to get done. There's all these business articles and podcasts I like to listen to, leadership, and they talk a lot about what's urgent and important, and what's maybe urgent but not that important, or what's not important and not urgent, right? Like there's a matrix. So really trying to still work on that, and focus on what's important.
I really appreciate that. And I can see how that evolution is probably common for many people, that when we first come out of school, we just sort of walk a common path where the majority of our pie chart of time really is taken up by work. And as we grow and develop and go through time. We have competing priorities, like you said, family. There might be things like our own self-care or spiritual practice or involvement in the community, and also the sense of having more ownership or more control over our schedules. And by making some adjustments like you did, like going with the teleconsulting route, you were able to shift your priorities around and have the quality of life that you're really seeking, which sounds really cool. And I'm glad you were able to make that journey. And you had mentioned some of the difficulties around navigating the legalities of the telemedicine, particularly directly to clients. Is there anything else you'd want to say to that for those listening who might be thinking of dabbling with telemedicine, like just some quick pro tips on how to investigate and make sure that they are within the legal limits and providing the best care?
Yeah, I think that's a great kind of a comment for me, because yes, I feel like it's a very dynamic conversation right now. You're either really interested in it or you're really afraid of it. And I think as the veterinary profession, we still have to be forward thinking. Now, you may not be totally for telemedicine, and I'm not necessarily advocating for, open everything. But at the same time, I also feel like there's a lot of our customers, the pet owners, that can't get in anywhere. They can't see like a specialist. That's a lot of the people I see is because they can't get in for quite a while, or they can't get into their vet for just, skin infections, bladder infections, whatever, and they can't get into ERs. I actually had a pet owner recently, because I do some locum work, and his dog had an infected toenail, and it was a dew claw. So kind of, do we remove it or what? And anyway, the ER clinic took the pet in and told them it was an emergency, but still charged them the full emergency fee. And I'm sure there were other things going on, but you can imagine as a consumer that's upsetting, right? Because he was basically told, well, you need to pay for this, but there's nothing we can do. It's not an emergency. And he sat there for like 3 or 4 hours. So my concern is the customer, the pet owners, they're going to figure out a way. And either as the veterinary community, we can either be proactive and try to find something to work with them, or we can be constantly reacting to whatever's happening in our own marketplace. And so I think we really, I just get a little frustrated when I hear people say all the what we can't do instead of anything that we can do. So I think we do need to flip our thinking a little bit on that front. And as far as telehealth, I think it is a great industry. And I think it's something, yes, you have to figure out what you're comfortable with, especially your scope of practice. I think for a lot of vets, there's a lot of missed revenue. Like, how did you just spend half an hour talking to a pet owner on a phone and you got no revenue? Like when we talk to our doctors, my guess is it all gets billed through insurance, so we don't see it. But I seriously doubt we're not paying for that. I don't know, but I would be surprised, right? But so many vets, they spend hours on the phone getting no revenue, or hours emailing, no revenue, or it doesn't even always make it into the medical record. So there's all different ways. And I'm not saying to overly business, it's not all about money, but at the same time, I think part of the problem with burnout and feeling like, people don't care is because we're also not valuing ourselves, right? Because, I hear from a lot of vets, they're like, well, it was just a quick phone call. And it's like, no, it was at least 8 years of education and 30 minutes, right? So it's like, you have to value what you are. So I guess that's my little soapbox a bit on telehealth and just how, we need to value our time a bit more. And in telehealth, it's all about the Practice Act laws, which aren't much fun to read through. I think if you're really serious, I would recommend getting an attorney. That's what I did. And then once I kind of figured out how they're reading things, then I was able to read some more of it on my own.
Good idea. Yeah, because I know it probably depends on state to state and what kind of medicine you're providing. So just do your due diligence and check in. Getting a lawyer to consult with is great. And I'm definitely an advocate for things developing more technology and solutions that help us all provide care more easily, help us get care more easily, while still being safe. And I think that it is a big conversation. We could probably do a whole nother podcast on that topic, honestly, get a panel together, because I think that'd be really fun. So thank you for shedding some light on your perspective on that. And then we'll move into the topic of the day. And I think this is a really important one. On my end, working as a coach and consultant in vet med, I often hear from people something that really stresses them out on a daily basis is having difficult conversations. And that can be both with clients, pet parents, as well as staff. And that they find this very challenging, especially on the palliative care side, delivering bad news. So I would love to just pass the mic over to you, because I know this is something that you're very passionate about and you speak on regularly. So tell us more about how we can do these difficult conversations better.
Yeah, that's a great question too, because it can really stress you out, right? I mean, nobody wants to give bad news. And sometimes we don't always see it coming, because certainly cancer is usually bad news. But sometimes telling somebody their pet's diabetic, that can be devastating too, or heart failure, that kind of stuff. So I think a lot of it, one, the more CE, so like you said, I do talks, and there's a lot of people out there. So any CE training you can do, I think it really helps. I also listening to podcasts, if there's any about these kind of topics, I think it's really helpful. And I think a lot of it with giving bad news, you need to have a plan. It's like most things in life. If you just sort of wander through it, well, that's sort of how it comes out, right? It's just sort of a blob. So if you have a plan, that really helps. And so it's something where you do need to kind of visualize in advance. All right, how am I going to say this? What am I going to say? And I think sometimes it's even going back to the beginning of, how do you communicate, period? Are you a good communicator? Do you think about your body language? Are you just staring? Do you not make any eye contact with people? Do you just stare at your notes and not look up? Are you making yourself small? There's all kinds of things that I think, especially as vets, because we're not always the most people person, right? I mean, we like animals. That's why, that's why we're in vet med. So I think that's where sometimes where to start is, how is your communication, period? How do you communicate with the staff? Like sometimes you can even check internally and doing exercises and things on communication and just seeing, just kind of making more of a note. Like, do you stand and talk kind of with your back turned to people? Like maybe you're taking notes, or is your hand on the doorknob? All kinds of, nonverbal cues that could really upset people, and you may not be realizing you're doing it. The other big thing is tone, right? I mean, I've was once a teenage girl, and certainly heard that a lot from my parents about my tone. And then I've got 2 little girls, and I'm already starting to have that conversation. So sometimes, what does your tone sound like? That can really throw people off. And maybe you're stressed about something else, or you're just stressed about giving them bad news, so you come off kind of rude. I've seen some vets that have done that, and pet owners get really turned off. I think the other big thing that I think a lot of people, thinking about your communication, and the other thing a lot of vets don't realize that's so important is actually silence. I think that's one of the biggest things. Like when you tell somebody bad news, and you can tell, right, when someone's upset, when they hear like, it's cancer, we may only be looking at a few months, or, whatever the situation. People's body language, it's quite obvious. And I remember with vet students, they always would talk about this later, because we would talk a lot about communication. And that was something they would always say. It was so awkward, but then they saw how powerful it was. Like if you have somebody, especially like if they're crying or about to cry, they put their head down, they're just, not looking at you. And, I would always really tell the students, it's really important just to stop talking, because they have so much going on in their head at that moment that they're not hearing you anyway. And so often, because that silence awkward, or we feel bad, and then we try to fix it, we try to make it better, which that actually makes things worse, and we just need to be quiet. And then I just wait for them, because people will they'll look back up at you, or they'll literally say, please continue, or, you just need to wait for them to give you some kind of cue. And I would say that's probably one of the biggest things you can do with, telling when you have to give bad news.
I know I would certainly appreciate that. I'm just imagining if I came to see you with one of my 3 amazing cats, and you were to say, sorry, this one unfortunately does have some type of cancer, and you're going to have this much time. I think that, for us to put ourselves in the shoes of the client receiving that news, just to allow them the grace and the space to have an emotional response, to not have to rush them through it. I think another thing that's very challenging in today's day and age is that we are so busy. There's often that ticking clock in the back of our head that we have all these other, clients and patients lined up waiting for us. And that the ticking clock of, the 30 seconds or 60 seconds or however many minutes it takes for that person to have that experience and to stand there in silence. I think there's that critical voice in our head that's like, you need to hurry this up. You have things to do. How do you combat that inner voice that wants to rush through things?
So for me, I think it's just learning to just kind of taking a deep breath myself, because often you're right. Our head's like, oh my gosh, this feels like an eternity. But the reality is it's just a few seconds, it's rarely more than a minute. It really is just a few seconds. So yeah, for me, it's just myself taking a deep breath and just knowing that this is only going to be a few seconds, really, of silence. It's rarely even a minute.
I think a deep breath is such a good tip for so many situations. Breathing is so helpful. And I want to go back to your first point was, first of all, just thinking about our communication style in general. And you pointed to, there are a variety of resources, whether it's some CE, some podcasts, just personal development in general of learning how to improve. I throw the word in there like emotional intelligence, our ability to read other people's emotions, understand and respond to emotions, be aware of how we're coming across, both our body language, our tone of voice, the words we're using. And then from there, you'd also mentioned the importance of a plan. I'd love to hear more about this. So I think just maybe an example of how you would plan a conversation with let's say it's a client that you have known for quite a while. So there's let's give two examples. I think these examples really help people imagine it. Let's do one of a case of somebody you've known for a while. So you've built some rapport and they're going to have a strong reaction because you've had such a relationship with this pet and family. And then another one might be something that's new and fresh and you don't know them as well. So it might be harder to plan, but still you're going to have to deliver bad news. Would those be examples that we could play with today?
Oh, for sure. Yeah. Because those are definitely what we run into. And for the one, especially the one that I've known for quite a while, I think when you're going to have to give them bad news, so in my case, I've already been treating the cancer, but let's say we do imaging or something and we found that it's progressed, So I do recommend either before you do that testing or after you do the testing, trying to talk with these people in person, if at all possible. I do think over the phone, there's just so much of that communication that's missed, and just, you never know what people are doing, right? People are multitasking all the time. And so I usually, if it's a staging day, right? So we're going to do imaging, then I usually talk to people in person before, like I said, or after. And if it's going to be bad news, especially if I know they're going to have a million questions, they're not going to take this well. Sometimes it would even be something where my staff would call and say, hey, we got the testing done. Dr. Venable wants to talk to you. Can you come back at X time or whatever? I mean, I think that's the ideal if you can do it in person. And then in person, some things that are important is, one, giving people a warning shot. So even though sometimes we think maybe that's tacky, maybe you shouldn't do it, but no, it actually, they found that mentally, if you say, well, we did the x-rays today and unfortunately it doesn't look good. That actually is helpful for people to mentally prepare versus just saying, so the x-rays found spread of cancer. It's just that nice warning shot is actually good. So I do give people a warning shot. And then I kind of see what they do a little bit. Because again, we might need a slight pause or, just kind of maybe how I come into the conversation with some of those people. And then the other thing is you just need to say it plainly. I think sometimes people beat around the bush or they just jump too quickly of well, we can do X, Y, Z, which you should have a plan. But at the same time, do we know what the goals of that plan are? I think that's where sometimes medicine, really in people especially, that's where we can run into trouble, right? Because everyone's more comfortable about talking about the plan, how we can treat this, and not, well, so we can do this massive surgery, but your pet's never going to be able to walk again. Is that still a quality of life you're acceptable with? And so that's where I think having that conversation of, whatever the situation is, we took the x-rays. Unfortunately, there's a lot of spread of disease now. So that means that it's not responding anymore, and then a lot of times we talk about there are some other options. And so I kind of just read people. I do a lot of chunk and check, right? So you deliver some info, you kind of pause. And then a lot of times I'll ask, do you have any questions about the x-rays? Do you have any questions about doing more treatment or what could happen at home? And so so I do kind of pause it. And again, I think it's just a new style because you may feel like, God, that takes forever. But when you learn how to do it, it doesn't actually take too long, not much longer than what you would normally do. So it's just learning that style. So that would be with somebody that I know pretty well. Because also with some of those, you can jump into what I already know. If I already know that's not going to fit their quality of life goals or things, we might jump into it more.
I'd love to just pause right there because I want to highlight chunk and check. People that are listening, please try this out. I think there's a tendency when we feel rushed to vomit out all the information. Like, unfortunately, I have bad news. This is what the tests show. Of course, we do this, that, blah, 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 blah. And what do you want to do? Right. And you can feel that the person along the way is probably having these little questions popping up, and they're probably not going to remember all of them by the time you get to the end of that long diatribe. So that's stressful. They might contact you later in the day or email you. And if you can just do the chunk and check, you often get more done in that time together. And it helps create a sense of relief for the client because they know that you are checking in to make sure they're really retaining and understanding what you just said. They're taking a few minutes to process it. You're able to gauge where to kind of take the conversation and navigate. So I've never heard it called chunk and check, but I love it. It's super easy to remember. So I want people to take that away from today. It's really fun. Chunk and check. It's worth it. Do it. Great.
Yes. Yeah, definitely worth it. And it just like what you said, I do think people kind of relax a little bit because I feel like they get a chance to ask their questions. And then because you're asking them questions, I think they feel like you are listening, right? That it's not just totally the doctor vomiting, all the information.
Right. Yeah. Like the active listening skills of we're talking to you, we're checking in to see if you understand it, making sure that we're on the same page, that we are, the information is truly being received. So that's wonderful. Great tip there. And I'd love to hear next your example of a client that you don't know much about and you have to deliver this information. So you're kind of going in cold. How would you plan for that?
Yeah, and I would say that's kind of what I do on a regular basis because a lot of my initial consults are people that are coming in I don't really know much about, and they're coming in to learn more about their pet's cancer. So whether it's over the computer or in the clinic, it's a very similar thing. In these situations, what I like to do is a couple things. So I like to tell people, first we rehash the history a little bit. And I always start it with, I've been looking through Fluffy's records. I just wanted to make sure, want to recap, make sure I'm on the same page. Because a lot of us, we probably at some point in our career had someone yell at us and say, well, didn't you read the records? Don't you know what's going on? But it is so important to double check. And so that's why I highlight that I have read the records. I just want to make sure, because sometimes things are missing, there's definitely, especially at the referral level, or like if you're a GP and you're a second opinion, you may not have gotten everything in the records, or they're like, well, we went to the ER 2 nights ago and they said XYZ, so I do think it's really important to double check the history. Again, it's usually pretty quick. Mm-hmm. And then before I really start talking about the cancer or whatever the bad thing is, I also like to tell people, we're going to go over, whatever, lymphoma, where I'm going to talk about the testing, treatment, big picture, everything. But before I get started, what questions do you have? Because when I ask that, it helps me to kind of know, where does this person want to go? Because I would say majority of people, when they see me, they just kind of want to know everything. And then they just ask questions as we go along. But there are some people that have very specific, they're like, well, I just want to know about what's going to happen to my pet and how do I keep them comfortable? I don't really think I'm interested in a lot of things, which I still go over some of the different treatments, but I might do it more briefly. Like I just kind of highlight it and then again, kind of check in with them and see, would you like to learn more about chemotherapy or not? So it can really help guide that conversation, which also helps on your time. Because if you know people's goals, then it can help steer your conversation so that it doesn't last too long.
Yeah. Oh, yeah. That makes so much sense. Well, great. Those are 2 really solid examples. You've given us a lot to work with on the things we should do if we're trying to have the best difficult conversation possible. Are there any things we should clearly stay away from? You'd say, please don't ever do this when you have a difficult conversation.
Yes. There's a couple things. And certainly you mentioned, the just vomiting all the information because you're kind of stressed out, right? So one thing not to do, don't try to paint a rosier picture, especially if you're telling somebody, your pet's diabetic and you're going to have to do regular treatments and all this, pretty intense stuff, or your pet has cancer. This is what we're looking at. Just let people feel that moment, whatever their feelings are. But don't try to say, well, at least, like if they're diabetic, don't say, well, at least they don't have cancer. Or if it's cancer, don't say, well, at least it's not, whatever, a worse cancer or something. I mean, there's times where, especially as you get to know someone better, you might be able to paint like rosier picture or highlight things. But especially when you're just giving bad news, don't try to make it better. It just is what it is, you know? So giving people that moment. The other thing I would say not to do is don't tell someone there's nothing we can do, because there's always something, you know? I mean, we don't want to put yourself in a situation where you're doing care where you're not comfortable, like futile care. But at the same time, you know, there's usually hospice options, you know, and so not forgetting, like, you know, does the pet need pain meds? Maybe antibiotics. You know, a lot of times tumors get infected. So especially like oral tumors or things like that. So remembering antibiotics, remembering, you know, also for people, they just want to know, well, what is this going to look like? Like, is my pet just not going to wake up one day, or is this going to be a drawn out thing? So yeah, just not trying to end the conversation abruptly by saying there's nothing we can do. That just leaves people feeling hopeless. And there's always something. I mean, even in veterinary medicine, I mean, not that euthanasia is a treatment, but it is an option. And sometimes it is reasonable. So I'm not saying that you can't bring that up, but just don't flat out say, well, I can't do anything and walk away. That also makes people really angry. And so if you wanted someone that's now going to become a real headache, that's, you know, how you could handle it.
Got it. Those are wonderful. So turning those into to-dos is really to provide options, let them know that there are things we can do. And if we can't extend life, there are still ways we can help make your pet more comfortable and help inform you of how the transition will go. I think that's really helpful. It gives a sense of control and gives a little more certainty to what the future will hold. And that can be really comforting. Yeah. Nice.
Yes, I think
you mentioned this aspect of cancer treatment that does, you know, with palliative care, that's a big part of it. I'd love to hear your words of wisdom around self-care for people that work in positions of, you know, having loss of pets and palliative care. And, you know, for the longevity of your career, what are some of the ways you all can care for yourself?
Yeah, it can be tough, right? I mean, a lot of times, you know, even clients will tell me, they're like, I don't know how you do this every day. And, you know, and it can be hard on the staff. And I think if everybody has the goal of we are helping people and we are helping pets, and maybe it's just in the sense of we're making them more comfortable, we're educating, because a lot of people, you know, like you said, that knowledge, it really is power. A lot of people calm down when they understand what they're facing and what they can do or not do, you know, I mean, whether they do anything. And so I think especially in like palliative care settings, you have to get kind of satisfaction in a way of knowing that you're helping these people at the end stages, you know, navigating things. Yes, we're not, and a lot of times, honestly, even in oncology, we're not curing a whole lot. It's more of, you know, we can give more time, but it's good quality and things like that. So yeah, so I think it's having the right mindset. You know, you have to have the right, what are your goals with this? Because if you just are so upset all the time because, you know, you're not curing things, then probably oncology or palliative care isn't the way to go. But I would say palliative care, I would feel better knowing that we're making these pets more comfortable. We're helping people get some time to say goodbye, various things like that. So I think reminding your staff that too. And also, you know, if you do have a really hard conversation, you know, because there's still now, there's times where it bothers me for various reasons, you know, whatever. Sometimes we get triggered by different things, right? And what's been found, and I'd say personally, and then even in studies, is going ahead and venting to a colleague, and not necessarily in a negative way per se, but just kind of letting it off your chest and trying to do it fairly soon afterwards. And I would encourage your staff to do that too. Now, you do have to be a bit careful because sometimes staff then complains about everyone. And I've been guilty of that a bit too. So making sure, you know, it's not complaining all the time. But like, you know, because some of these cases, they are really sad. You know, it's like, oh, this person, their spouse died and this was all they had left. Or, you know, I've had some, I remember where their kids committed suicide and this was their dog. Or, you know, it's a heavy stuff a lot of these people are dealing with. And so I think, so for myself, knowing that I'm still helping them in the situation of just what it is, you know, when they feel out of control and just trying to help these people. And then also for myself, venting to other people. And I think you also have to have, like for me, exercise is something that really helps for me. So I can usually tell when I'm not regularly exercising because I don't sleep as well. So, you know, like everybody has something, but exercise is for me spiritually. So like having faith, believing in God, that's something that's very important to me too. And I think for me, especially a lot of these heavy topics, because a lot of times clients will open up to you about things that, I'm not a therapist, but and so just having my own faith, I think it helps navigate through some of these tough times.
Absolutely. You hit on some important things. And it makes me think of some of the clinics that I work with when I watch them collectively have a process around difficult endings. And so like lighting candles, they all have a text group and they'll start texting each other about it, sharing pictures of the pet, from previous visits, and just really allowing for that emotional expression, and that there's not it's not taboo at all, that they just show they really love that pet or the pet and client, and they're really sad about what had to happen, and they're allowed to have their emotions about it. And I think that's a very sweet way to see a team come together. And that, from a personality perspective, I think some people are really cut out for palliative care. They have something in them that is just able to hold the bigness of death and to be with people through that transition. And I think it's a very special time. Yeah. So as we're coming down the home stretch today, I'm thinking about all that we've talked about today around having difficult conversations. And I want to see if we could bring this to a close with some, top takeaways, maybe 2 to 3 tips for people listening today. If nothing else sticks, but these 2 or 3 points, what do you want people to leave with today?
So big things I would say is, try to work smarter, not harder, right? So try to think, how can you, like having a plan if you're going to have a difficult conversation, kind of think, mentally rehearse, have things set up, like I said, doing some CE or things so that you can get better, more comfortable with this stuff. And then also maybe just in your workflow, do you have times where you can, have a little more time to talk with some of these people? Or do you feel like, you're constantly on the phone and, so almost wasting time in a sense because you're not better utilizing yourself? So I would think about those things. The other thing, giving bad news silence, it really is, don't interrupt. So that's part, like we were talking about, the active listening really is important, because really the more you listen, which a lot of times we're still doing the majority of the talking, people feel the reception is so much better. And so you get better compliance, you get less complaints, not to say that there still aren't troubled people, but it helps in the long run. So even though in the moment it may feel like it's taking longer, it's likely not. And then, like I said, with that, trying to set goals, kind of all this, just sort of that, how can you work smarter so you know how to shorten, kind of streamline the conversation. The silence is really important. And then access to care, how can we help people, with, is part of the reason they're so stressed out because they can't get into an oncologist or, or whatever that could be. And so, so certainly I'm happy to help with my teleconsulting and do some of that hard conversation for you. Because I do feel like as oncologists, like I know in my residency, we actually did get a lot of training with communication, and we're really encouraged to do that. And we worked with counselors and things. And so you really learned a lot. And then I also learned, where to look up like CE and all that kind of stuff just to stay on top of it too.
Mm-hmm. That's a lot of what I provide too. So oftentimes when I'm working with clinics, they're asking for plans on like, how do we develop our staff? And so helping point them to different types of CE they can use across their clinic to develop some of these skills. Because we're often so gung-ho about the clinical skills, like how do I place that catheter? How do I learn anesthesia? That's wonderful. I'm so glad you're learning that. At the same time, some of these things we have to do every day, like having emotional intelligence, having difficult conversations, active listening skills, they can just make our workday feel so much more pleasurable and easy. So I really appreciate your pro tips. And I'd like for us to leave off with you talking about how people can find you and just explaining a little bit more about your model of care. Because I think that, for myself listening in as a pet parent, I think about, what happens if I did need to get in to see a specialist, an oncologist? I call around and they are booked out for like 3 months. And I'm an anxious pet parent. I want to know now. I know something's going on. I'd like to be able to consult and have some kind of certainty around what I should do to move forward in this next 3 months. So tell us about that. How can people connect with you, and how does it work to work with somebody that's teleconsulting?
Yeah, thank you. So my service is called Pet Cancer Care Consulting, which I realize is a mouthful, but it explains what it is in the title. So yes, this is a good option for pet owners that maybe they can't get in because it's too long to get into the oncologist, or maybe they're kind of wishy-washy and they can't decide, or it's a long distance. For a lot of people, if you don't live near a major city, you can't get into oncologist, so it could be quite a drive. So I do work with the veterinarian, and as the vet, I definitely don't want people to feel like, oh, if I commit to doing this, I'm committing to giving chemotherapy or stuff that you're not comfortable with, because you're definitely not. A lot of times, again, people want that information. There's actually a lot of pill options anymore, which a lot of owners like, and I can certainly help vet clinics with the pill options because generally you don't need as much special equipment. It's not as much of an issue exposure-wise. And then I also work with a lot of other oncologists. I really try to help them. I partner with several where, they're booking out for a long time. So I can help see these clients. And then if they want to do chemo and that sort of thing, I can help coordinate and streamline them in to see the oncologist. So lots of different options, and just, again, trying to help people so they can get access and get that information before it's too late.
Nice. So if I was seeing my GP and they had detected something and any local oncologist was not available for many months, I could have my veterinarian reach out to you to schedule a consult and to help facilitate like a 3-way conversation.
Exactly. So yeah, the clinics just make an account with me online, which is free. And that's how we can coordinate and schedule, send records, all kinds of stuff. There's all kinds of ways to reach me essentially from the website. So you can message and all kinds of, so if you're a pet owner, you can message and can help coordinate and figure out, because it does depend on the state. But a lot of states, since I work through vet clinics, we're able to do that consult and get that help.
Really smart. I love the model. Okay, fabulous. So then how do people find you? Do you have a website you want to point out to people? What's the best way for them to reach you?
So probably the website. So it's the name, it's petcancercareconsulting.com. Explains how it all works, all different ways to message me there. Of course, we have Facebook and Instagram, LinkedIn, all the same name. So nobody else had taken that name. So it's just that straight name.
Who would have guessed? Awesome. So I'll link all that stuff up in the show notes so people don't have to hunt for it. And Dr. Venable, I've just appreciated you being here so much. It's been a very interesting conversation. And I appreciate all the words of wisdom that you've shared today on how to manage difficult conversations well.
Oh, thank you. It's certainly my pleasure to be on. Thank you so much for this great interview. I love chatting with you.
Absolutely. Me too. I hope you have a great day. Thank you for joining me today. I hope that you feel stoked after listening to this episode. And as always, I would love to hear your comments and feedback. Is there a topic that you want to know more about? Please let me know. And thank you again for subscribing and sharing your favorite episodes with others. It really means a lot.